Bismillahirrahmanirrahim. Assalamu alaikum. I welcome all the audience who are watching us from different parts of the world to today's webinar being brought to you by Imamia Medics International Women's Wing, Calgary chapter from Canada. You are watching us live on my TV YouTube page of Imamia Medics International. And this webinar is a very significant one being brought to you in the month of October, which is related to breast cancer awareness. And we'll begin this with the recitation of holy verses. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم إنا أعطيناك كالكوثر فصل لربك وانحر إن شانئك هو الأبتر. Translation. In the name of Allah, the Merciful, the Compassionate. O Prophet, we have surely bestowed upon you good in abundance. So offer prayer and sacrifice to your Lord alone. Verily, your enemy alone has been cut off from the roots. Sadaqallahul Aliyyul Azim. Once again, I welcome all the audience who are joining us from different parts of the world. And I would like to mention that because you are watching us live on YouTube, and when we go forward in the program, as our speakers, esteemed speakers, give their talk to you, you can put up your questions in the comment section of YouTube. And I will now introduce our moderator for today's program without any delay. We have with us esteemed Dr. Memuna Bhatt. She is a lecturer at University of Calgary, Cummings School of Medicine, conducting interviews and file reviews for medical students at University of Calgary, University of Alberta, and University of Medicine. She has played the examiner roles for IMGs and other medical students, an active member of organizations such as AIMGA, FJ Alumni, PCA, MD International, working at a family medical clinic along with training medical students and residents, working part-time at PCN Access Clinic to offer patients semi-urgent services. We are honored to have you, Dr. Memuna Bhatt, and we welcome you to today's webinar. Request you to kindly unmute yourself.
Bismillahirrahmanirrahim. Thank you, Varda, for the kind introduction. Good morning, everyone. We are going to discuss about a very important topic today, as Varda has mentioned, that needs an immense awareness, and the physicians here will explain to us why is that so. It's going to be a very interesting, interactive talk and easy to understand for everyone here. So stay with us till the end so we can share the information along to others and to our loved ones. Thank you all for being here. I'm pleased to introduce Dr. Sakina Raj. Most of you must have known her for a long time already. We have known her since the year, like us. I have known her for the last few years, since 2004. She is a practicing physician, currently serving as a family physician in Calgary. She's an assistant professor at the University of Calgary for the last 25 years. So she brings us 40 plus years of experience, especially in women's health and breast cancer aftercare. Dr. Raj has been actively involved in many leadership roles for organizations here and nationwide. Today, Dr. Sakina Raj will be speaking with us about the prevalence and other important aspects of breast cancer. Please join me in welcoming Dr. Raj, Sakina Raj. To you, Dr. Raj.
Bismillahirrahmanirrahim. Hi, everyone, and salam. I'm not going to give you a very traditional talk, which you can find in Google's, but one of the IMG students have helped me prepare some real story slides. His name is Dr. Abul Fazal Lukmani, and I really want to thank him because in short time he could prepare my slides too. These are my real cases, and why I'm showing you is that we are not aware of, and awareness is not reading Google. Awareness is what I'm just in 10 minutes show you, and then my colleagues will explain to you in more details. So 1 in 8 women in Canada, can you imagine? 1 in 8 women. Every month, I can swear I get 1 or 2 breast cancer or pre-cancer patients. Early detection can significantly improve treatment options and survival outcomes. Let me share some stories which we may think that it can never happen. Next slide, please. So this is 33 years old woman comes to me with lump, and to tell you the prevalence, 1 in 3,000 pregnancies will have breast cancer, young age. There are many risk factors which my colleague, Dr. Rizvi, will go through. In quick case presentation, I'll tell you this interesting story. This women, you can easily miss these or pregnancy hormonal related changes in the breast can mask the cancer signs, making detection challenging. So we say, oh, your breast is like growing, and because of pregnancy, you'll find these. And these lumps are ignored. So what we have learned is any lumps, tenderness, nipple discharge in pregnancy, please, maybe it's a hormonal changes, either follow up closely and get the ultrasound or something done early. Also, surgery is possible in pregnancy. Chemo is safe after second trimester. Early detection leads to favorable outcomes. Next slide. Now, this was a real case, and it was really distressing. This patient is no more with us. She was very young mother, second pregnancy. She had this postpartum lump. She went to gynecologist after 6 weeks, and she said it's mastitis, just take ibuprofen, warm compressions. She went to her family doctor, same thing. She should have gone to the same doctor for follow-up. They would have done same what I did. She came, oh, I know, Dr. Raj, you are experienced, and somebody told me about you, and this lump is not going away. And then, of course, the investigation showed she had a metastatic cancer. It was sad. So in pregnancy, postpartum, early age, please be aware that any lumps or any abnormalities, you have to take care of them. Go to your doctor 2 times, 3 times. It's not that family doctor or gynecologist missed it. It's just follow-up is needed. Next slide, please. There is a male breast cancer. Now we will all be shocked that 60 years old man came to me. He has found lump himself. And then, of course, it turned out to be a breast cancer. And treatments are long, but luckily it was not metastasized, so he's still living. There are some risk factors for male cancers: age, family history, obesity, hormonal imbalances, and BRCA. These are gene mutations. Again, there's a lump, there is a nipple discharge. So usually when men come, especially 60 years old, how many female family physician or any family physician will look at their breast, right? So sometimes we have to teach our patients that be aware of your body changes. Next slide. Now, of course, the detection through screening is common. And as I said, after whatever is the guidelines in your provinces, guidelines, I think Dr. Rijvi will go through what age you should get your screening test done. So do choose not to do the screening test. Once a year, see your doctor, get your screening test done. You'll be amazed how many lumps we cannot feel or you cannot feel, and you have no symptoms. But the screening mammogram, one of my colleague doctor, we just joked with her, and she went for mammogram, and there was a breast cancer metastasized. So all the screening is important, and we do pick up lots of breast cancers through screening. Next slide. I'm rushing on the slides because there are more speakers and interesting talks, and we'll take more question answers. Now at age 80 or 90, or people are living longer now, by virtue of our good medical care and good nutrition and environment. So when we do the physical exam, they hardly let us do anything. They'll not show your breast or abdomen. And you don't send them for ultrasound or mammogram or screening test, right? So make sure, and I have made a habit that you have to do your physical exam, put your hands on their all body parts to see if there's any abnormal lumps. I found this one just by checking. She said, no, it's nothing, and I'm too old to do anything. I did send her, and she got the treatment, and she's like 85 or 86 now. So at old age also, it's important. And 20% of diagnoses occur in women over 75 for different types of cancers, and breast cancer is one of them. Even I got vaginal cancer in one or two patients. So do thorough body check when you do your annual physical exams. And key message is breast exams matters at every age. No one is too old for screening. Okay, so this is my case number 5. And I will leave there for Dr. Rizvi to take over for other pathology and investigations and treatment mode. And we'll meet again at question and answer sessions. Thank you very much.
Perfect. Thank you very much, Dr. Raj. Who knew at 80-year-old somebody can be diagnosed with cancer, and men, especially in when men, we can miss the diagnosis and the pregnancy especially. So it's very important, as Dr. Raj mentioned. Thank you very much for the heads up, Dr. Raj. And definitely we'll go into details after she will be here. Dr. Raj will be here for all your questions that you might have in your mind later. So now let me introduce you to another well-experienced physician who is here with us, Dr. Masuma Rizvi. She is an MBBS MRCOG. She has over 12 years of experience in the medical field, out of which 7 years she has served in the gynae ops department. Being in that department, she gained lots of experience in conducting seminars on women's health and awareness of diseases that are prevalent in that population. So all to you, Dr. Rizvi.
As Assalamu alaikum. Thank you so much, Dr. Maimuna and IMI team, and also Dr. Raj for like giving this presentation and giving me the chance to be speak about. So continuing to the topic, I just want to like cover with the sign and symptoms. So sign and symptoms, I have like as screen is being shared, there is a symptoms like mostly this is the lump is appear as a lump, a small lump. It could be like as small as a bean size. So don't ignore if like anyone is like feeling that there is a lump or any hard nodular or any shape. So we have to like concentrate on these type of the symptoms. So and if we are ignoring these symptoms, what is the side effect? That the cancer grow up and then it appears into the late stages, and then with the late symptoms, these are appearing with the metastasis metastasis. After the like metastasize, there is the symptoms like for example, there is the double vision, there is the muscles pain, headache. So patients are coming up. I have like a lot of experience in like I have seen personally lots of patients. They are coming with these symptom, and no one can like think that okay, like these are the symptom because they have just ignored those symptoms which were appear the lump or something, and then later on they have come already and at the metastasize phase. So we all have to be careful. This all webinar and the seminar purpose is to be aware of that. Simple small things can prevent us from the like being developed the like breast cancer. So what we can do is we can do the self examination. Self examination is very Very, very good. And so here, like three question arise: who have to do the self examination, when we have to do the self examination, and how we have to do the self examination, and what is the like outcome of the self examination, right? So I'll answer all of these question one by one. So first of all, who have to do the self examination? So guideline says that all of them, everyone who have the like breast issue, as Dr. Raj mentioned, there was like 80 years old men who have developed the breast cancer. So it doesn't matter it's a female or a male. So all have to, whoever have the breast tissue, they have to go for the like, it's better to go for the self examination. So now we and it is recommended at for the like females to start self examination at the age of even 20. If they will have this habit to like self examining every monthly, then it will be a very good thing that they can prevent themselves from the breast cancer. So now another question is, who when we have to do. So when we have to do is if they are like menstruating like periods under reproductive age, then they can do it after the like last after the like periods. Okay, this is the best time to do. And if they are postmenopausal, then they have to choose either like they can select any date, like for example first of the each month or the 15th of the each month, whatever they like. They have to do like they have to like mark in the in calendar that this is my examination date. So now the third question is how to do, which is very important. How to do. So how to do, we have like guideline says that the examination should be in the three steps. One is under the shower. Okay. Second is in front of the mirror. The third is when you are laying down. These are the very important studies. Some people, they just like examine just only at the first step, for example during the shower, and they are okay. No, they don't. They have to do all these three steps, that it should be under the shower, in front of the mirror, and laying down position. Because when these three separate like position, they will gonna make like it can like we are like reducing the risk of the missing any lump in these three different positions. So now there is the question that how we have to do. So is these are the three finger, the middle three fingers. They have to do is just only 2 or 3 minutes. They have to like examine the whole breast tissue along with the armpit. If they are doing it during these three states, as I have discussed, during the shower, in front of the mirror, or the laying down, and the laying down, then they will be able to like make sure that there is no any lump. So now, and this what is the importance, why we are doing this self examination, why it is important? It can studies suggest that 40% of the cancers can be prevented just only by doing this small habit. You can say a small habit, or like a small monitoring, or a small examination. It can prevent like 40% early detection. And as Dr. Raj have mentioned, the incidence rate is like one in every 8 women have breast cancer, right? So if we are doing this, we can prevent 1 out of 4 women can be prevented from the cancer late stage, or like developing these things, because these are can be like preventable just by doing simple measure. And what is that? That's us self examination. So now, for example, if someone have developed any lump, okay. So now another question is came: do I have to be panic that like I have the lump, I have to like rush to the doctor, or should I be like really anxious? No, you don't have to be panic. Okay, because out 8 out of 10 lumps are non cancer. Okay, but it will gonna give you early going to the hospital, so it can like prevent further progress of the cancer if there is the cancer. Now another question arises that can I rely on only the self examination? Do I need some more testing or not? So yes, self examination is not sufficient, because self examination, it will gonna, as Dr. Raj have mentioned, there is like mammogram, there is ultrasound. They will gonna detect the lump before it appear into the skin. So this is very important to go for the screening. So now we are going to discuss who have to go for the screening and what ages are the good for the screening. So in generally, there is like a 50 to 79 years old, they have to go for the screening every year, or like 2 year, depending on and also but Alberta guideline says that 45 to like 74 years of old age, they can do the self referral. But if someone have the breast history, like family history, or any other risk factor, for example obesity and these things, so they have to go between 40 to 44 age. They can talk to the family physician, and then they can family physician can give the early referral. So 40 to 44 age, it should be through the like GP, general physician. And from the 45 to the 74 age, it could be self referral too. So no one need to go to the doctor, and then they can just go directly to the places for the mammogram, and then get it done. So now we are going to like discuss the other things, is like signs. So during this self examination, as the slide shows, what we have to look for: there is the lump, there is the any lipal discharge, any dimpling, any breast like a nipple pain, or like nipple uh, ret- re- retraction, or like redness, any swelling. So we have to be like concentrate on these things, that we are not going to miss any of these sign and symptoms. Next slide, please. Okay, so now we are going to discuss what is the cancer stages, and the grading. So first of all, what is the difference between the stages and the like grade? So grading is like when there is a cancer, is like how much it is invasive, how is the cancer is like going inside the cell, while the staging is like how much is like spreading in a way, how much is like spread toward the lymph node. Is it spreading toward the like is it other breast also, other axilla also? So this is the staging. So for the staging, there are the four stages, from 0 to 4. The fourth one is the like metastasize, so the cancer has been spread outside of the axilla and the breast boundary. So from 0 to 3, there is like limited. These staging, we are doing it on the basis of the T and M: tumor size, lymph node involvement, and how much it is spread. So 0 to 3 are like localized, but the 4 stage means it has been spread. So just by doing simple measure of the self examination, we can prevent 40 by doing 40% of the early detection, we can prevent breast cancer to be going toward the fourth stage. Next slide, please. So now we are going to on the mammogram. There is breast have the like two types of the tissue. One is the glandular, and one is the like fatty part. So as this slide shows, that there is the fatty part, and the like pink one is the like glandular part. So on this ratio, the mammogram result will gonna show what type of the density of the breast it is. Is it like type 1, type B, type C, or type D? Type C and D, they have the more, as the picture is seen, there is like more dense tissue. It has glandular part plus there is the fatty part. So what happens? Density of this type C and D are like they are more dense. So what happen is when there is a more density, it just hide the like tumor. So on the mammogram it just all appears as the white color. So that's why this is very important to have screening to be done every yearly to like for the early like prevention. Next slide please. Okay, so now we are going to like discuss what is the like treatment option. So early data, we have like surgery. There is the hormonal therapy, there is targeted therapy, radiation, and the like chemotherapy. So these all are the like treatment option, and so depending on the stage, if we have early detection, it will gonna be only surgery is like sufficient. But if there is if there is a metastasis to the lymph nodes, then doctor have to like give the chemo and then the radio as well along with the surgery. So just a small doing by a small self examination, habit of the self examination, and annual screening can like prevent someone life from being breast cancer. Next slide please. So this is my last slide, and it just shows like if we have to go through with the breast cancer, then they are doing with the breast implants through the like some silicone. And also we can do with the like flap from the other part of the body, from the belly or the back or the buttocks. So from these three places they are taking the like flaps and then doing the surgery for the breast. That's all.
Thank you very much, Dr. Rizvi. That was truly amazing to see how self-examination and proper follow-ups with the family physicians or your doctor can prevent someone's life and their loved ones' lives. Definitely. Thank you very much.
Thank you.
So we will proceed to the question answers now. We can ask the public too to share their questions on YouTube under comments, and then we can ask these experts about that. So first of all, Dr. Raj, would you let the audience know about the resources that are available for us, for everyone who is suffering from breast cancer, how to go and where to go, what are the good resources that they can go to and not just Google it around?
Yes. Can I share the slide which is showing resources? Dr. Masuma, it was a very good presentation, and it was short because we just gave you the headlines. We cannot tell everything here, but your questions are welcome. I'll just add, because I am in practice for so long, what happens in Alberta quickly. We are now, of course, she mentioned self-exam, which is important, but we are not advocating self-exam too much because of false alarms. So what guidelines are saying not to do it, but I tell my patients, which I'm sharing, is once a month after your periods are over, if you're still having menses, and just in your shower, just feel your breast to know your body, not only breast, but maybe wherever you can, and just mindfulness, look at that. Oh, this is something, but that doesn't mean that you have a fat collection somewhere and you think, oh, it's a lump and run to the doctor, or your normal breasts. When they age, there may be calcifications. So that's know your breast. You don't have to be alarmed. Oh, what is this? What is that? Don't do that. Once you are doing once a month self-exam and something comes up which was not there before, then bring to attention to the doctors. Number one. Number two, what happens is once you are in Alberta, we know, and Calgary, how I deal with it is that when I find, say, the earliest stage is called DCIS, right? That is precancerous or a lump or whatever. And mammograms and ultrasound show very clearly that there is a high suspicious of cancer. They offer to patients without even, they will tell us, but they will offer biopsy right away. And if cancer is diagnosed, they call us right away and we refer you to the oncology or breast cancer program, which is a good program. Unfortunately, the waiting time has increased because there's so many breast cancers and some of our favorite doctors have retired. So it's a little bit challenged, but still they look after you. There is a team who will be talking to you and they discuss your case, and by individual cases, your age, your other comorbidities, your family history, your body habitus, the staging of the cancers, they outline treatment according to your need. Okay. Now, when I'm saying your journey starts here, there may be some patients attending this session which are aftercare patients, like what they have to do after getting all the treatment done. It is very devastating news that you have a cancer and breast cancer. Breast cancers are so much treatable. I have 25 to 30 years breast cancer survivors in my practice because I'm practicing now 26 years here in Calgary. There is a lot of support. So right away, I send the patients to this, especially Wellspring, Alberta, which has a holistic support and wellness programs for cancer patients, any cancer patients, especially breast cancer. So they get counseling, they get exercise program, and it's to meet with your peers or same kind of patients to talk to them. It's such a, supportive program. And others are like Alberta Cancer Foundation, Rethink Breast Cancer. It's a community-driven resources for all genders and ages, Canadian breast cancers, and then Breast Cancer Network. These are few. And then some of my references are there if anybody wants to read the last slide. So some of the references we have taken from here, which anybody can read, and some are for doctors and some are for laypersons too. Thank you.
Thank you, Dr. Raj, for elaborative discussion about the references, because once someone gets the breast cancer, they find themselves lost. So if they have this information, the valid information, they can really get benefit out of it. Thanks a lot for that. We have a question from the audience. Any one of you who thinks can answer, please go ahead. One is, are there any chances of recurrence after the surgical removal of lump and after chemotherapy?
So should I answer, Dr. Rizvi, and you can add anything you know? So
Sure,
what
sure.
we do, because I do deal with breast cancer patients here. So what was happening before, like before COVID, was there was a very good breast program. So these oncologists, they will have a full package like aftercare also. Yes, recurrence can happen. And two of my patients had, after 25 years, had recurrence on the chest wall. And because we are monitoring and there is a pattern of how to monitor them. Now they are asking family doctors, so I am doing it and I'm sure Dr. Bhatt is doing it. So when they are discharged from the cancer program, we have to, they give us like when we should do the mammogram, MRI. They do send us a whole package of up till how much we have to monitor them. So first 2 years is a close monitoring every 6 months, mammogram after 6 months, MRI, and then once we know it's stable and no recurrence, then every year they have to get their mammogram ultrasound done. So which is tedious for us, but of course we have now AIs and our good CHR, which pops up reminders for us too. So yes, recurrence is, I don't remember right now how much is the prevalence, but in my practice, I had a couple of recurrences.
That's right, Dr. Raj. I have seen patients with recurrence too, even after 5 and 10 years after the first cancer. So the patients get referred over here and we take care of them from going forward. So thank you. For the second question is, are ovarian cancers and breast cancers related? Is there a relationship between the two cancers?
Dr. Rizvi, you can comment if you...
Uh, there, if there is the BRCA genes, if these are like present, then there is the like risk that they can develop the ovarian cancer too, BRCA 1 and 2. So there is the like 40% and there and 60% chances that they could develop the ovarian cancer too.
Okay, can I add, Dr. Rizvi,
Yeah.
you are very right. And we haven't brought up too much of genetic in our risk factors. Family history is very important. And nowadays, BRCA1 and BRCA2, as she said, BRCA,
Yeah.
are important tests. So once you have a family history, we and a couple of like sisters and immediate family, mother had it and a real aunt and a couple of them, then we do send for genetic testing. Nowadays, if you have heard of RAD, R-A-D, I have one patient going through that. So that will get cancers. They have cancer genes and lots of cancers can happen to them, including ovarian cancer and breast cancer. And when the patient had, and actually this patient had cyst, she's going for a preventative ovarectomy. They are removing the ovaries just because RAD positive and there is a cyst. So be aware of that. If you have family history, bring attention to your doctor.
That's correct. Thank you, Dr. Raj and Dr. Rizvi. So speaking of family history, so someone also asked this question, how to lower the risk of breast cancer if you have a family history of breast cancer? So all the preventative measures, we already talked about some of them. So for example, examination and your lifestyle does matter too. What do you think? Dr.
Yes.
Raj, Dr. Rizvi, anyone?
Yes, there is the like two types of the like risk factor. We can divide them into what we can modifiable and the like non modifiable. So the weight and the obesity, these are like coming up with the like modifiable. So just by like even is study shows that only 20 minutes of the walk in a day, just 20-minute walk a day, will gonna reduce the risk of the breast cancer as well. Sedentary and like slow life will gonna increase the risk. Obesity increase the like risk. So these are like modifiable. Of course, genetic factors are coming under the non modifiable factors. So we can easily like prevent at least. Just by like controlling these factors.
Definitely. And also smoking and drinking.
Yes,
We have to
smoking and
avoid that.
alcohol and
Mhm.
smoking, they have also
Yeah,
done.
very nicely explained. Thanks, Dr. Rizvi. I'll add that stress, yeah, of course, stress causes everything, and monitoring. So please take care of your own health and don't say that, oh, after 5 years, my family doctor did not do this or that. That's not true. You know your family history is there. You have to look after yourself. Go and see family doctor as many times as you need to, but monitoring yourself and reminding even your doctors. I'm asking these patients to keep medical diary. And remember, write down the dates when their memo is due or ultrasound is due. I give them the whole paper with dates, and I ask someone or myself to put an EMR reminder too. So these things are not missed, but you have to take responsibility of your follow-up also.
Perfect. Thank you very much. So talking of someone having breast cancer in a younger age, reproductive age, can it affect their period and ability to conceive in the future?
Dr. Rizvi, she's a gynecologist background. I'll let her speak.
Yeah, a study shows that there is like a relation because of course when they are going through the like breast cancer, they are going through some stress and these things, and fertility is like mainly from the hormones control as well. So when they are going through the stress, their like stress hormone will gonna get more, and then there is it just reduce the like fertility rate. There is
Yes.
the study shows that, yeah.
Correct. This is a good study, but I'll add that, listen, it all depends on the staging. So I have like 28 years old going through metastatic breast cancer. So
Yeah.
she had so much of radiation and chemo that
Mhm.
she has a chemical now, like menopause, right? So she cannot conceive. So if it's an early stage and your surgery is done, or even your radiation or chemo is finished, and chances are that you'll be you can conceive or fertility can be normal. It all depends on your staging and the treatment type. But if it's advanced metastatic, lot of chemo, then chances are that your ovaries will shut down.
That's right, definitely. So that's why it's very important if anyone feels a lump, they have to contact their doctors right away so we can prevent the complications from it. So speaking of density, breast density and the structure of breast, as Dr. Rizvi has explained in her slides too. So someone asked about the relationship of density and the cancer risk. So I'm pretty sure Dr. Rizvi explained in her slides that the more the breasts are dense, the more chances are there to miss breast cancer because they appear exactly the same. So the radiologists over here are really very experienced. They can follow up the patient with the ultrasound. So the additional ultrasounds are done on those patients if there's a suspicion between the breast density in a dense breast, then they do a follow-up ultrasound, and most of the cancers are detected through that examination if they find that. Right, Dr. Rizvi?
Yes. Mammogram plus ultrasound both are like very good combination to like detect these type of cancers. If they are being missed on the mammogram due to the density, they can easily be like detected on ultrasound.
Yes, and I'll add one thing, and I'll tell you one interesting story. This one, yes, mammogram and ultrasound, but actually radiologists themselves suggest that we should do their monitoring earlier. So usually in Alberta, it's every 2 years if your breasts are normal. But for these dense breasts, they do every 6 months or 1 year. I had a patient move from Saskatchewan, and the radiologist have told them that you have a benign lump and just monitor it. When she came to me, I don't know, maybe it's my sixth sense, or she was looking weaker, like not thriving well, and she has lost weight and other constitutional symptoms. So I said, no, even radiologist said to monitor, I'll get biopsy done. And lol, it was breast cancer. She still remembers, but the thing is, it's sometimes challenging, and we should not rely on all radiology and technology. Sometimes your experience, your examination, or your follow-up can give you better results.
And thorough history, definitely.
Yeah, definitely.
Thorough history and full examination, it was detected that she has constitutional symptoms, so that we have to keep a note of it, definitely. And it's not only for breast cancer, it can be any cancer in the body. So we have thorough examination, and physical history is still the mainstay of medical practice. And then they said, I know we hear about all those myths too, and patients are worried. Like someone having a mammogram, when we tell them, they're, oh no, I'm not going to do that. First of all, it is too painful. And second, I've heard, I've Googled, it can cause cancer. The mammogram itself can cause cancer. So these are some of the myths that have to be, addressed. So what do you think about those?
Yeah, in my experience, every time, oh, I'll not go to mammo, please send just ultrasound. And I'm telling you now, the technology is so good, they do not cause so much of pain. I myself went through mammogram, and it was little discomfort, but it's not as painful as it was 10 years ago. So technology is better, diagnosis chances are better. Ultrasound looks at some other things, mammogram looks for other things. So sometimes mammogram can pick up, sometimes ultrasound can pick up. So if the radiologist is saying do ultrasound, get it done. Or when we are doing ultrasound, they said mammogram is needed, do not say no. Little discomfort is better than having cancer or cancer spreading in your body.
That's correct. I was in a conference recently about breast cancer. The radiologist had that in Calgary, and they were telling me that there are curved pads available on the mammogram machine now. They are less discomforting, and those are for bigger breasts, so they can still detect. And some are padded ones, but yeah, we should not ignore. It's very temporary, like 1 second, 2 second discomfort, but it can save someone's life, definitely. And yes, mammogram does not cause cancer. Please do not listen to those talks. It is very important, and it can be life-saving, as we said.
I think they did tell in that conference too that the radiation is much less than even X-rays. So it's not that it's giving you a lot of radiation through those, right? Dr.
Yes.
Masuma does ultrasounds, a very special ultrasound she does. Yeah, can you tell a little bit about that also,
Yeah,
and the
that
radiation? Yeah.
yeah. So mammogram is like is low who like what can say
Low risk.
low risk. Yeah, it these are the X-ray, but these are with the like
Low
with
radiation.
the lower radiation. Yes, and I am doing also the like 5D ultrasound for the like pregnancy. So these are also, and these are just like a sound waves is going inside the body, and then when it come back, it just like create the image.
The
So that is
5D,
how.
5D.
Yeah, 5D
Wow.
ultrasound.
So you can
Even
see.
yes, exactly. Even I was reading, and then I have found that there is the 3D mammogram is also coming up, and then it will gonna increase, like improve the like quality, that in a way that it has less false positive like detection. So that's why like technology is like really improving, is coming
Amazing.
up. Yeah, 3D, and also the like contrast enhanced mammogram.
That's right. So yeah, in pregnancies we do ultrasounds all the time, and so far babies have been normal, no complications that we know. So they're pretty safe, and when they develop those technologies, of course, they take into consideration about the risks and the effects of that. So, someone suffering from breast cancer, of course, it's the family that gets the impact too. Children, husbands, their loved ones. So, what is the role of family in that case? I mean, they're definitely stressed out. They don't know, because mother has the central role in her family. So once she is sick, she needs the support not only from the physicians and nurses and healthcare providers, but also from the family. So, any suggestions for the family in that case, how to support their mom, their wife?
So I'll just answer, and then if Dr. Rizvi has something can add. Usually the oncology program here, breast cancers, they usually do a family meeting. So husbands or kids can join. So to discuss the treatment plan and what's going on. So they're pretty good in that. If they haven't done it, then in my practice, I do call them and we sit and then I give them, we have a PCN counselor. They can sit with them too. The whole family can talk with them. And then there is a wellspring. So once they are diagnosed with cancer and have a cancer treatment started, the wellspring can give counseling sessions to them. And the Breast Supportive Care Association is there. They are pretty good. So the peers are also, people share their families and their own journey through the treatment and aftercare. So that's a good resources. But I think it's very important to let the family get involved. Otherwise, they come after 3 months and start blaming and shouting at you that you haven't done this or that.
Definitely, definitely. When anyone else gets sick, moms also take care of them and they kind of know how to take care of it. And we know that when moms get sick, they don't get that in back when they are sick. Nobody knows how to take care of moms. But yeah, there are resources available. So definitely the family can go over and have counseling sessions and they will support you. So, talking of which, we have one more question from the audience. Uh, if someone, and I think Dr. Rizvi already mentioned about, they're talking about reconstruction surgeries, what is available and to what extent. Little bit more, if you can explain, Dr. Rizvi, about that.
Yeah, there is like three type. We can do it from the like silicone implants, and there is the flap thing as well, from the belly, back, and the like buttocks. We can take the like part of that skin, and then they are like flapping surgery through this.
So I think we can talk,
Yeah.
Dr. Memuna, about take-home messages. So I'll
Yes.
let you.
So yeah, about the side effect, there was last question about side effects of chemotherapy. Definitely there are side effects, but the breast program is very supportive and they talk about all the aftercare. So definitely we can go to those resources. Thank you very much, Dr. Sakina Raj and Dr. Rizvi, for your expert opinions about this very important topic. And we hope that we can get another session because we are getting lots of questions. So definitely we can address those questions in our next session. So it will be advertised whenever it is available. Over to you, Varda.
Vada, I'll just say take-home message. Screening is important. Listen to your body and talk it out. Don't hide it. One of my patients hid her lump, knowing her sister had a cancer for 5 years, and then it was in the bone and brain. So do not let that happen.
Right, right. Thank you so much, Dr. Sakina Raj. Thank you so much, Dr. Masuma Rizvi, and thank you so much, Dr. Memuna Bhatt, for coming together and bringing to us such an informative webinar. I would also like to thank our Women's Wing team member, Dr. Nazneen Zaidi, who from the Canada chapter has worked hard to coordinate this webinar and in every step of this way. And I would also like to thank the media head, Sir Asher Zaidi from Imamia Medics International, for helping us throughout this webinar. And in the end, with all the takeaways, I think what we have learned from today's webinar is a lot. But I think from what everyone has said, what we have learned is that do not ignore the symptoms, take care of yourself and take care of your family. And inshallah, we'll come up with more such informative webinars in the coming future. Till then, everyone take care. Allah Hafiz.